In health news tonight, ask most British Columbians if they believe in organ donation, and they'll tell you yes. But the number of people who actually follow through on their convictions and register to become donors is nowhere near as high. In an effort to change that, BC hospitals are trying new techniques to make a tough conversation a bit easier and educating potential donors about the process. Robin Stickley has the details.
You know, like I'd have to plan, like if I was going to go from here to the elevator, I'd have to decide where I was going to stop, where I was going to lean. You know, is there a bench at the bottom of the elevator, or I just got to sit on the floor, you know, because I had to catch my breath, you know.
A cystic fibrosis patient, Darby Colton, remembers a time when he couldn't take a deep breath or walk 10 feet without feeling winded. In December 2006, he says he won the lottery. A double lung transplant gave him new life. On this National Organ Donor Awareness Week, Darby's proud to be part of a new campaign in BC, Live Life, Pass It On.
My name is Ava. I'm 23 years old, and I have a genetic disease called cystic fibrosis.
The black and white photos were the brainchild of Ava Markvort, seen here in a documentary about her transplant process. Like Darby, she was a CF patient and received a double lung transplant. Sadly, she passed away in March of 2010.
If we'd had other opportunities, she might have been here if we were able to get the right match for a second transplant.
Dr. Greg Grant says the statistics show 95% of British Columbians would accept an organ if they needed one. Only 18% of us register as donors. Part of the problem, he believes, misconceptions around the topic.
Well, you know, some people still are suspicious that if they sign their donor card, that we're not going to look after them, that we're going to treat them as donors instead of patients, you know, and that doesn't happen in BC.
Grant says doctors caring for terminally ill patients in hospital are expected to ask patients, and in some cases family members, about organ donation. For many physicians, that feels like a conflict of interest. So the plan is to take the onus off of the doctors.
We're putting in-house coordinators that work for BC Transplant into hospitals across BC with the idea that they're going to be people that are going to be asking those questions for us. We're going to train them to do that, and it's a separate team that asks that question.
Amanda Poach is a liver transplant recipient. 6 months after surgery, she wrote to her donor family, wanting them to understand the magnitude of their selfless decision.
It is very, very difficult to write because you really have a moment to reflect back on the fact that if it wasn't for this person, I wouldn't be here to write the letter at all. And so if I could give them any type of solace that, you know, someone is living on the other side because of that, then I hope that maybe they can find some peace in regards to their own grief.
In the next 5 or 6 years, Amanda will need another liver. She'll join the 450 British Columbians on average who are on the waiting list. Both Amanda and Darby are hopeful the campaign and their message hits home.
You know, people don't think about these things. You don't think about needing to be an organ donor until it's in your face.
You got to think of it in terms of a little girl, or your dad, or your mom, you know, who needs a transplant. Why wouldn't you provide that? You know? Why wouldn't you provide it?